This is severe anemia. But the most important thing, you can only make a proper diagnosis of anemia by doing a blood test.
Yes, and the baby too. You can see the contrast between the baby's palms and that of the doctor holding it.
Yes. It is also good to mention that anemia can rapidly develop in children as a result of malaria parasitemia. Malaria parasites actually reside inside the red blood cells and cause lysis of the red blood cells. In children where their total blood volume is very small, malaria can almost completely consume circulating blood within hours. So that is why you see cases like that.
Okay.
Very common in children.
Okay, now talking about, the diagnosis. Of course, you've said you could see, looking into the eyes, the person is pale and all of that. But the full blood count you mentioned, what will be the range that will say, okay, this is okay and this is below what it should be?
The circulating serum hemoglobin should not be less than 12.5 grams per 100 mils of blood. And you begin to worry about anemia when you begin to get levels that are less than 11. And by the time you get to levels that are less than 8, you are talking about severe anemia. And the old books used to say that you transfuse blood when your circulating hemoglobin concentration is less than 8.
Okay, and this is PCV. What's that about?
I told you
Packed cell volume.
I told you that the concentration of hemoglobin inside each red blood cell is roughly about 30%. And that is actually the relationship between the PCV and the HB. If HB, when you are now narrowing yourself down to hemoglobin, you are not talking about hemoglobin, whatever you get, the PCV will be 3 times that.
Okay, because I think people will connect more with PCV.
PCV is packed cell volume. You are talking about centrifugation of blood, bringing down the red cells and getting the percentage of the red cells through the rest of the whole blood.
Okay.
It will always come as 3 times that of the level you get when you do hemoglobin concentration.
All right, we'll just take a quick break, and when we come back, we'll be talking more about how to manage and, of course, prevent anemia. And, of course, you can join us in this discussion on 0189-23-900 or send your tweet to yomi_Otaiwe. We'll be back. Welcome back. We're talking anemia, the causes, and how to prevent it. You can join us in this discussion on 0189-23-900 or send tweet at yomi_Otaiwe. Okay, before we go into the treatment, let's quickly look at the various forms of anemia.
It is good to quickly mention a particular form of anemia called megaloblastic anemia.
Oh no, that's a big name.
we call them megaloblastic anemia because when you investigate, you see the red cells are bigger than normal. It is not only iron deficiency anemia that causes anemia. Deficiency of folic acid, deficiency of vitamin B12, which are necessary for the formation of DNA, can actually cause megaloblastic anemia. If you find anemia and you begin to give iron, and the cause of that anemia is B12 and folic acid deficiency, you will not. So it is good to mention that. Another group is called pernicious anemia. There is something called intrinsic factor. That intrinsic factor is made by the stomach. If there's a problem with the stomach, they call it atrophic gastritis. If, for some reason, part of the stomach is removed by surgery, you rid the patient of the normal supply of intrinsic factor. Intrinsic factor is necessary for vitamin B12 absorption in the intestine. All this will eventually lead to pernicious anemia. So in the process of investigating anemia, it is good to
know which type it's at play and then how to treat it. Okay, before we go into that, I think we have a caller. Hello.
Hello, good afternoon, ma'am.
Thank you so much for joining us.
Good afternoon, thank you. My question, hello, ma'am.
Go ahead, please.
I want to ask a question on one aspect. You know whether you will permit me, it does not go with the anemia issue. Hello?
Okay, go ahead.
Man, I want to show the doctor, Mr. Iziola, today about today. I don't know.
Yes, Dr. Lusumade.
Thank you. Please, I want to confirm. There's something that normally happens to some human beings. It's like there are some human beings that have ruminants. Are you getting what I'm saying?
No, can you, I don't know. Could you repeat that?
I want to speak, I'm speaking on the ruminant and non-ruminant. It happened to one of my
Ruminant.
friends, and up to now we could not get the solution to this.
Okay, thank you, Babatunde. Let's see. Did you get ruminants?
I honestly don't.
Okay.
I don't think what he's talking about has anything to do with.
No. He
Anemia.
says it's not about anemia. He just wants to know
I
about...
don't get it.
Okay. Maybe Babatunde could call back at the end of the program. Okay, so let's go into the management of, perhaps picking it, iron deficiency, anemia, and the likes.
In mild cases, especially when we have discovered that the problem is iron deficiency, then what is needed is iron supplements. One of the things I would like to say is that the intestinal absorption of iron, when it is given as supplements, is helped by vitamin C. So we usually advise patients to take their drugs with orange juice. Then the other aspect of it is, it depends on the time you have. For example, you have a pregnant woman who is due to deliver within a week or two, and you find her to be grossly deficient, to be anemic, and you need iron supplements. Some of the cases we use what is called parenteral iron. Those are irons that are administered directly, intramuscularly, and you are able to achieve elevation of their hemoglobin concentration at a rate that is much faster than when you administer it orally. I mentioned to you that there's an aspect of anemia that is caused by patients suffering from chronic kidney disease. The kidney, there's a part of the kidney called juxtaglomerular apparatus. It secretes a hormone that is called erythropoietin. That erythropoietin stimulates the bone marrow to produce red cells as the need may be. So you can understand people who have problems with their kidneys will be anemic.
Okay, let's take this caller. Hello?
Hello, please, afternoon.
Thank you for joining us. Go ahead, please, with your question.
Yeah, I want to find out, can this anemia something cause high blood pressure?
Okay.
Or what role does it play in high blood pressure?
All right, thank you, Amos.
The cause of blood pressure worldwide is unknown in more than 90% of cases. Anemia does not have any pathophysiology in the development of hypertension. So, as I was saying,
but can anemia also low blood pressure?
Anemia has
there's no
absolutely,
relationship,
except in places where you have blood loss, sudden blood loss, accidents, surgery, bleeding, peptic ulcer, esophageal varices, that will cause hypotension. Okay. That's a physical, So what I'm trying to get to is that it is now possible to actually get that erythropoietin outside. So you can now use it to restore blood concentration in people who have chronic kidney diseases, but you can also use it to increase hemoglobin concentration or to stimulate the bone marrow to push more blood, even in people who don't have.
Okay.
So
now,
that is...
Let me quickly go back to the issue of the iron deficiency anemia and its treatment and management. What are those food that is the, diets that can help us?
What is usually advised are the green leafy vegetables, and they should not be over boiled so as not to cause damage to the existing nutrients and vitamins and iron that they contain. Those are the major forms of iron. But you can also get iron in some fruits. You can get iron in carrots. Some of the fresh fish also contain ions, but largely from green leafy vegetables.
Vegetables.
The darker
So
the
darker,
yes,
the better.
the more iron. Yes.
Okay, and not
The
overboiled.
control. Not overboiled.
Okay, so let's quickly go to, the iron deficiency or anemia that is caused, for instance, by the destruction of the red blood cells.
Most of the anemia that is caused by the destruction of red blood cells, apart from replacing the deficiency, it is good to remove the cause. For example, in malaria, you treat malaria aggressively. In infections, you treat aggressively. And in ones that are caused by hemoglobinopathies, you also rehydrate and treat aggressively.
Accordingly. And of course, as you say, we should remember to eat green leafy vegetables and
yes.
What more?
Well, regular blood analysis to know your level of hemoglobin concentration is also important, because finding anemia in somebody who is otherwise not sick might be a way of making a diagnosis of what is called aplastic anemia. Forgot to mention it is becoming common in this environment. It's a condition in which the whole bone marrow stops production of everything, including the red blood cells, and it's the mortality rate is very high.
Okay, so if a full blood count will not be bad, at intervals.
Yes, it's a continuous part of a regular medical checkup.
Thank you so much for coming today on the program.
It's a pleasure.
And thank you all for watching at home. I'd like to thank Babatunde, who called in from Jeba, Amos, who called in from Abule Egba, and a whole lot of other people who tried to get in. But you can watch this over and over again at youtube.com/channelsweb. I'm Yomi Otaigbe. Thank you for staying with us.